Hi, Dr. Erin from the Johnston Health Center. Today we have another video to offer you, and these are some tips and some advice on how to keep your body feeling great while we're all sitting at home on our computers working away during this lockdown. So we discussed how important it is that every 20 to 25 minutes our phone goes off, alarm goes off, we stand up, we shake out, we reset our posture muscles, we sit back down again. At that hour mark, we're going to get up, we're going to go for a quick walk around the living room. We are going to do our very simple stretching, right? So we're doing our range of motion stretching and with our cervical spine, and we're doing our rotation with our shoulders, 5 forward, 5 back. Now, here's another thing to add to those two exercises when we're sitting at our hour mark, or you can do this in the other portion. So if you don't want to do all the exercises at the same time, no problem, just space them apart, simple. So this exercise is a great glute stretch. So while we're sitting, we can put our foot over on top of our knee. We're going to lift up nice and tall. I don't want you to push down on your knee just yet, okay? So all we're doing is we're holding our leg here, we're sitting up nice and tall, and then we're just going to lean forward. And that stretch is going to give you a stretch in the glutes and in through the hip as well. So again, up tall and leaning forward, not pressing on that knee, okay? So we're going to hold for 30 seconds, and then we're going to come back down. We're going to go to the other side. Other leg up, sitting up nice and tall, not putting pressure on the knee, and we're just going to come forward. Perfect. So we've got the posterior, right? We've got the glutes and we've got the hip. So this stretch that we're going to go through is actually really important. If you really think about it, you're probably sitting a lot more than when you're at the office. Because at the office, you're getting up, you're moving, you're going to talk to coworkers. We're at home, you're probably sitting in front of your computer. And then what do you do on your break time? You sit and grab your phone or you're watching TV. So if you were to really track the number of steps that you're doing right now, I've seen it so much in my practice that patients are doing a lot less. And that's what we need to change. So when you have a moment, I want you up, I want you moving. So with all the extra sitting, these hip flexors are shortening and they're tightening up. So we need to stretch them out. So when you're standing, so at that hour mark, after you do this exercise here and you're coming forward, I want you up. And we're going to go into a slight lunge. So we come into a neutral position. We're going to step back with that back leg here, and it's like a lunge, okay? And you're going to feel a stretch on this side, okay? So I'm feeling a stretch on my right hip flexor right now. So there's different ways of increasing it. We can have our arms up, but chances are if you're just starting this exercise, you'll feel a great stretch just like this. So you're going to hold this for 30 to 35 seconds, 40 seconds, whatever you can do. Then we're going to lean forward, come out of that safely, and we're going to do the next side, okay? So we're going to step back, we're going to lunge back. I'm actually doing the same side, but just so that you guys can see. So we're going to stretch back, we're going to feel that hip flexor on the right hand side, stretch out. Make sure that you're not leaning to one side or the other. Keep your center of gravity right over top of your hips. Now we're going to feel that stretch. We're going to hold for 30 to 35 seconds. When we come out of it, lean forward a little bit, push off, come back to a neutral position. Great. So if you have any questions, if you have any suggestions, or you want to hear any more information specifically on a topic that you want addressed, just give us a shout. You know where to find us. Have a great day.